You're listening to Scan Stories, a bite-sized audio journey from GS1 Healthcare, where we bring you stories from those implementing GS1 standards around the world. I'm Mia, and this is Scan Stories. Imagine needing surgery and no one's quite sure if the device being used is expired, fake, or mislabeled. Scary, right? That's the kind of risk hospitals face every day when they don't have a clear way to track medical supplies. At the first affiliated hospital of Sun Yat-sen University in China, managing thousands of medical devices had become a complex and risky job, full of paperwork, delays, and room for error. But instead of adding more staff or more spreadsheets, they did something smarter. They gave every device a digital identity using something called UDI, which stands for Unique Device Identification, and paired it with GS1 global standards. In this episode, we'll learn more on how this hospital became a pioneer in digital healthcare logistics and what it means for patient safety, efficiency, and the future of care. Let's start with the challenge. Hospitals don't just treat patients, they also manage mountains of medical equipment and supplies. And at this hospital, the process was manual. Staff had to write or enter codes by hand. If one digit was off, it could cause a serious mistake. Worse, there was no easy way to track devices across their journey, from warehouse to ward to operating room. The acceptance of new supplies could take nearly an hour. Reporting an adverse event, like a faulty device, that meant digging through forms and spreadsheets. It was time-consuming. It was error-prone. And it just wasn't good enough. So what did they do? The hospital turned to unique device identification, which is like giving each medical item its own digital fingerprint. Now, every device comes with a unique code that tells you everything you need to know: who made it, when it expires, what batch it came from, and more. Staff simply scan a barcode, on arrival, during storage, or right before it's used on a patient, and the system handles the rest. They even use smart cabinets, think of them as intelligent storage lockers, that can detect what's inside, track expiration dates, and even sound an alert if something's missing or going out of date. And at the bedside, nurses can scan the patient's wristband and the product, instantly connecting the treatment to the patient's records and billing system. What used to take 45 minutes now takes 2. Everything's tracked. Nothing slips through the cracks. So how does this all work together? That's where GS1 standards come in. Each device is assigned a Global Trade Item Number, or GTIN for short, which is a key part of the Unique Device Identification System. This GTIN is stored in a GS1 barcode that contains essential information for healthcare use. GS1 standards make sure everyone, from manufacturers to hospitals, is speaking the same digital language. No confusion, no mismatched systems. It means staff can instantly verify a product's details. It means data flows smoothly across systems. And it makes it much harder for fake or unsafe products to sneak in. That's the power of GS1 global standards. They turn a simple scan into a trusted source of truth. So what's the impact? The hospital now tracks 100% of high-value medical supplies across their entire life cycle, ensuring complete visibility from delivery to patient use. Acceptance times for incoming devices have been dramatically reduced, from 45 minutes to just 2, freeing up staff and improving overall efficiency. And when something goes wrong, the hospital can respond faster. They're now logging more than 150 adverse events a year through the system, each one recorded quickly, accurately, and with full traceability. But they're not stopping there. They're setting up a training centre to help other hospitals learn from their success. They're documenting their system in research papers and patents. And they're exploring how other GS1 standards, like tracking rooms, staff, and patients, can add even more visibility. Their goal? To build a smarter, safer, more connected healthcare system. I hope you liked this story. I think it just shows how technology, when paired with the right standards, can truly transform healthcare. By using unique device identification and GS1 barcodes, the first affiliated hospital of Sun Yat-sen University is proving that better care isn't just about more doctors or beds. It's also about better data, better systems, and better traceability. This episode is based on a case study published on GS1.org, authored by Tan Jiawen, Miao Jiaqing, Yu Donglan, and Wu Liwa, who are all experts in UDI and smart medical device management at the first affiliated hospital of Sun Yat-sen University in China. Thanks for tuning in to Scan Stories, a podcast by GS1 Healthcare. If you found this episode useful, please share it and follow for more real-world stories of standards in action. Until next time, keep scanning for solutions that make a difference.